Welcome to our channel. In today's video, we are going to discuss some common questions on acid-base barons that you would expect in your exam. So let's begin. Question number 1. The expected blood gas result from a patient in a chronic renal failure would match the pattern of A. Metabolic acidosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Respiratory alkalosis. What is your best option? The best option is A. Metabolic acidosis. So, under normal conditions, the body produces a net excess of acid in form of hydrogen ion each day, and that must be excreted by the kidney, and the level is expected to be around 50 to 100 millimole per liter. So then, in case of kidney failure, there will be no excretion or reduced excretion of acid from the kidneys. That would contribute to metabolic acidosis. How about you? Question number 2. Severe diarrhea causes A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. The best option is A. Metabolic acidosis. Excessive loss of bicarbonates from diarrhea or drainage from a biliary, pancreatic, or intestinal fistula can lead to metabolic acidosis. How about you? The third question. The following blood gas results were obtained. pH 7.18, partial pressure of oxygen 86 millimeter of mercury, partial pressure of carbon dioxide 6 millimeter of mercury, oxygen saturation 92%, bicarbonate ions 7,921 milliequivalent per liter, or 21 millimole per liter. Total carbon dioxide 23 millimole per liter. Base excess minus 8 milliequivalent per liter, or minus 8 millimole per liter. So the patient's results are compatible with which of the following? A. Fever, uremia, emphysema, and dehydration. What is your best answer? The best option is C. Emphysema. So the results are consistent with respiratory acidosis because of the accumulation of carbon dioxide and also reduction of oxygen saturation, which is 92%, which normally should be above 95%, and of course a low pH. So that will be consistent with the emphysema, which is the accumulation of fluids in the alveoli of lungs. That of course will limit expulsion of oxygen, of CO2 from lungs. So how did you do? The fourth question. A 68-year-old man arrives in the emergency room with a glucose level of 722 milligram per deciliter and a serum acetone of 4 plus and diluted specimen. In arterial blood gas from this patient is likely to be A. Low pH, B. High pH, C. Low partial pressure of oxygen, D. High partial pressure of oxygen. The best option is A. Low pH. So this patient is suffering from diabetic ketoacidosis, which of course contributes to metabolic acidosis, and of course with a low pH. So how about you? Question number 5. A patient is admitted to the emergency room in a state of metabolic alkalosis. Which of the following would be consistent with this diagnosis? A. High total carbon dioxide with increased bicarbonate ion. Low total carbon dioxide with increased bicarbonate ion. High total carbon dioxide with decreased carbonic acid. Low total carbon dioxide with decreased carbonic acid. The best option is A. High total carbon dioxide with increased bicarbonate ion. So because the patient was admitted with a state of metabolic alkalosis, so that is consistent with increased bicarbonate ion, and also high total carbon dioxide because of lung compensation. So lung can compensate immediately during metabolic states. So then in metabolic alkalosis, lung will compensate by retaining carbon dioxide, and that of course will contribute to the increased concentration of total carbon dioxide in blood. So how about you? Question number 6. A person suspected of having metabolic alkalosis would have which of the following laboratory findings? A. Carbon dioxide content and the partial pressure of carbon dioxide elevated with pH decreased. Carbon dioxide content decreased and pH elevated. Carbon dioxide content and partial pressure of carbon dioxide and pH decreased. Then carbon dioxide content and pH elevated. So the best option is D. Carbon dioxide content and pH are elevated. So this condition is metabolic alkalosis, which is of course consistent with pH elevation. And also, as we explained, in metabolic alkalosis, lung would compensate for that by retaining carbon dioxide, which will always increase carbon dioxide content. So how about you? Question number 7. Metabolic acidosis is described as an increase in carbon dioxide content and partial pressure of carbon dioxide with a decreased pH. B. Decrease in carbon dioxide content with an increased in pH. C. Increase in carbon dioxide with an increased in pH. D. Decrease in carbon dioxide content and partial pressure of carbon dioxide with decreased in pH. The best option is D. Decrease in carbon dioxide content and partial pressure of carbon dioxide with a decrease in pH. So Metabolic acidosis is a non-respiratory content, so it is associated with decrease in pH, of course, as in acidosis, but also decrease in carbon dioxide will be anticipated because of immediate response of the lungs by expelling carbon dioxide in order to try to increase pH or decrease acidemia. So that is why decrease in carbon dioxide will also be anticipated, because also lungs cannot correct the issue completely, so the still pH will be decreased. So how about you? Question number 8. A blood gas sample was sent to the lab on ice and a bubble was present in a syringe, and the blood had been exposed to room air for at least 30 minutes. The following change in blood gas will occur. A. Carbon dioxide content decreased with the partial pressure of carbon dioxide decreased. CO2 content and PO2 increased with pH increased. Carbon dioxide content and carbon dioxide partial pressure decreased with pH decreased. D. Partial pressure of oxygen increased and bicarbonate decreased. The best option is D. Partial pressure of oxygen will increase and also there will be decrease in total bicarbonate ion. So air bubble does not have significant effects on carbon dioxide content and also on pH, but it does have significant effects on partial pressure of oxygen. That's why it will always increase in the presence of air bubble. So how about you overall? So if you think you still have issues in clinical chemistry in general, enroll in our program for training and further assistance. Thank you so much for watching the video. Subscribe to our channel and watch subsequent videos.